What is up, YouTube? It's your boy, Willis STI here, back with another video. And I'm also known as your local bone scientist. And today I'm going to be teaching you about six diseases or conditions related to the skeletal system. The first disease that we'll be talking about is sickle cell disease. Sickle cell disease is an inherited disease that causes severe bone pain. Under low oxygen conditions, abnormal hemoglobin, which is an oxygen-carrying protein, will bend red blood cells into sickle cell shapes, obstructing circulation and blocking blood flow in the bones. As you can see here, this is normal red blood cells, which are just circular or oval shaped and can pass through pretty easily. And here are the sickled red blood cells, which are in the shape of a sickle and obstruct blood flow. Next condition related to the skeletal system is osteopenia. Osteopenia is when bone density is lower than normal peak bone density, but is not low enough to be considered osteoporosis. People start to lose bone density after the age of around 30, meaning that there is a higher chance for bone breakage. Limited physical activity, smoking, and malnourishment are factors in osteopenia. Here we see the differences between a normal bone and an osteopenia bone. As you can see, the osteopenia bone has less bone density than the normal bone. The next condition we will be talking about is osteoporosis. Osteoporosis has no symptoms and is like osteopenia, but is a more severe version of osteopenia. Osteoporosis is also the breaking down in the density of bones, but it's more than osteopenia and is considered more severe. Here is a picture, the difference between osteopenia and osteoporosis. And here, osteopenia bone density has begun to dwindle, but is not yet considered dangerous. And with osteoporosis, bone density levels become critical and frequent fractures are likely. So with osteoporosis, there is an even higher risk of bone breakage than osteopenia. They are like the same thing, but osteoporosis is more severe than osteopenia. The next condition we'll be talking about is scoliosis. Scoliosis is when the spine has a bend to either side of it. Any curvature more than 10 degrees is considered to be scoliosis. Scoliosis appears most often during growth spurts, and there are two types, structural and non-structural. Non-structural scoliosis can be caused by muscle spasms, one leg being longer, inflammation, and a variety of other factors. Structural scoliosis can be caused by cerebral palsy, tumors, birth defects, infections, and other various factors. As you can see, this man right here has scoliosis because his spine bends like this. And the next type of disease we're going to be talking about is Scoliosis disease, which can cause a painful, bony bump on the shin bone just below the knee. It usually occurs in children and adolescents experiencing growth spurts during puberty. Scoliosis disease occurs most often in children who participate in sports that involve running, jumping, and swift changes of direction, such as soccer, basketball, figure skating, and ballet. Scoliosis disease typically occurs in boys between ages 12 to 14 and girls between ages 10 to 13. The difference is because girls experience puberty earlier than boys, and the condition usually resolves itself on its own once the children's bones stop growing. Here's a demonstration of Scoliosis disease. Here's pain right there. The next and final condition we'll be talking about is spondylolisthesis. Spondylolisthesis is a condition in which one bone in your back or vertebra slides forward over the other bone below it. It most often occurs in the lower spine, and in some cases this may lead to your spinal cord or nerve roots being squeezed. Sometimes when a vertebra slips out of place, you you may have no symptoms at all, or no symptoms until years later. Then you may have pain in your lower back or buttock. Muscles in your leg may even feel tight or weak, and you may even limp. Spondylolisthesis is caused by a problem with one or more of these small joints that allows one bone to move out of line. Spondylolisthesis may be caused by any of a number of problems with the small joints in your back. You could have a defective joint that you've had since birth, a joint damaged by an accident or other trauma, a vertebra with a stress fracture caused from the overuse of the joint, and a joint damaged by an infection or arthritis. As you can see here, there's 3 levels of the condition. There's pars interactularis, there's spondylolisthesis, and there's spondylolisthesis, which is the most severe. And here you can see the bone breakage from the joint causing the spondylolisthesis. I hope you enjoyed these 6 diseases or conditions related to the skeletal system by your local bone scientist, also known as Wolf's TI. So if you enjoyed the video, please like and subscribe, comment, and yeah, see you later, Wolf's Army.